So we spent a half hour treating Donna, and several of the stretches were 5 minutes long, some were 3 minutes, and one of them was 10 minutes. And I thought I'd have her give us a little bit of feedback. How many hands-on practitioners had you seen?
Well over 20.
Good. And so you've seen 20. How does this approach compare to what you've received?
Well, first of all, you went through my whole body to see where I was basically what I describe as stuck, and tested everything. And I think that's amazing, because most people that I went to, you know, they just focus on the one area that's bothering me and don't really take into consideration everything else that's attached to it. So it's a fascinating process.
So the whole body approach just isn't being utilized much in the 20 practitioners that you've seen.
No, absolutely not.
And then what about the actual treatment technique? How does this compare to others that you've had?
Oh wow! It's, to me, and I'll say it again, it's fascinating the way that you test the joints and the whole body is just, it's so much different than anybody has ever done. And I mean, I don't even know how to describe it. It just is, it works.
Yeah, so some of the techniques I used with you was direct hands-on. So when I mobilized your talus, I did 30 reps, 30 oscillations. But then when we treated your knees and your pelvis, we had foam fulcrums and then applied a force for 5 minutes. So there's those two different approaches. Real soon we'll film you walking, and then we'll film me going through each of the patterns that you had. But let's have you walk up and down the hall once and just tell us how you feel walking.
Okay. I definitely feel more loose. I don't feel like I'm walking like I'm just this rigid stick anymore. I feel like I can actually move different parts of my body, that it's not when, you know, it felt like my pelvis was stuck and it just went up into my back.
Yes, yes.
And my feet. Like, my feet feel so much looser and not like rigid.
Nice.
You know? Like,
nice.
I can actually move my feet around, and I'm not like walking like you know.
That describes perfectly how they were moving before.
Yeah.
And how about the pelvis?
Oh, my pelvis feels so much better. It feels looser. It feels like it's, you know, there's movement on each side, and I'm not just like, you know, like a robot.
Sure, sure. Come lie on your back. And then scoot up with your feet on the bed, yeah. Very good. So we did gain some dorsiflexion, but not a lot. You know, we probably gained 5 degrees there. But what we really gained was this play in the subtalar joint. So you have a lot more ab and adduction. And even if I squeeze the malleoli and just isolate subtalar, you still have a lot of motion there. You have a little bit of eversion, and you certainly have a fair amount of inversion, and that was absent. The knee is still in a little bit of a flexion contracture, but now I hit the back of the soft tissue right away with 2 fingers, and on this side as well, I tested it a while ago, and I hit soft tissue very early. So these did straighten out by perhaps 5 degrees. We certainly have more room to go, so we want to work on that every single day, and hopefully in a month's time, hopefully they'll be a lot straighter. The pelvis softened up considerably, so now I can take up the slack and I can spring it, and there's a recoil, and that's in every direction. Okay? So if I had you on your stomach, it would show the same thing, that there's now passive play. In the interest of time, I'm not going to do that. Your scapula are much freer, your AC joint is much freer. Now I can take up the slack here on the AC joint, and I can spring it. I'm capturing the acromion there. So there's freer mobility there, and there is inferior mobility through the scapula now. I did not have to treat your upper neck because reflexively, the blocked mobility in the OA joint was in response to the blocked mobility in your pelvis. And that was reflexively driven, and now I can do traction to you and I can see your feet move up and down. I come on top of the mastoid and I can spring it very freely. So we've made some good gains, and here's side bending and side bending that way. So I think what we'll do is stop filming, and then we'll film a part 3, which will be a very quick demonstration of how I treated you. So this is day 1. We've got 2 more days to go with you.
Yay!
And much to teach you about how to maintain this, and that'll be easy.
Okay.
That'll be things you do a couple times a week, and that'll maintain the mobility throughout. Alrighty, so let's stop filming.